Let's talk a little bit about choosing a good chiropractor to help manage your spinal pathology or problems. We have a challenge in the United States insofar as medical care in general and spinal care specifically is siloed. Patients go from one provider to the next and to the next, and very little of their medical care is managed, and very little is thought of in terms of the long-term perspective. It's all short-term. What are we going to do with this in the moment, and what treatments do I have in my treatment bag, so to speak, that I can deliver to you? The chiropractor can be an excellent spinal management provider for you. You want to find a chiropractor that is integrated in the medical community, a chiropractor that knows the good physical therapists to go to, the good pain management physicians to see, who are the good surgeons, a chiropractor that may be able to reach out to a surgeon and say, look, I have this case and this is my thought, can you get them in? And the surgeon be responsive to that. And that's something that you would want to have with your chiropractor in managing your case. A chiropractor, I think, that makes wild claims, such as, I'm curing a disease that is outside of the realm of spinal biomechanics and musculoskeletal disease, I might have a little bit of caution about. I don't doubt that they can do some wonderful and miraculous things, but generally speaking, in my field of expertise, I would say that you want to find a chiropractor who specializes in spinal care and musculoskeletal care, and is again integrated in the community in delivering that care. One final thing I think ought to be considered: the chiropractors should be looking at your imaging. They should be invested in your x-rays and MRI scans, etc. I think if they are having a hard time reading your images or don't really know what studies to order, you might consider finding somebody else. A good chiropractor, and one of the advantages a chiropractor can have, is the ability to understand the imaging that they are using to help make a diagnosis and to manage your case. In summary, a chiropractor that I would consider to be a good spine management provider would be integrated into the medical community, would be focused on musculoskeletal disease, and would have a good and fundamental understanding of imaging and what your underlying pathology is.